They work alongside us, often in jobs like construction and food services. And while COVID-19 impacted everyone, a recent study finds undocumented migrant workers took a big hit when it came to their health and finances. Advocates say their immigration status forced them to go without help.
First of all, not having job. They were having challenges with their housing because they were not able to pay the rent. They were having challenges even with the provide food, because if they were not having work, their savings were very low.
Loli Rico is the executive director at the FCJ Refugee Center in Toronto. At the height of the pandemic, the center was helping more than 700 families with food and funds, and partnering with the city on vaccination efforts for this vulnerable group.
Canadians, we need to learn is that anyone who is beside us, that they can contribute into the economy of this society, could be a person that doesn't have a status.
Such workers don't have OHIP coverage and weren't eligible for government support, such as the Canada Emergency Response Benefit. A survey led by researchers at University of Toronto and York University working with the FCJ Refugee Center highlights the struggle the group went through during the pandemic. 195 current and former non-status migrants took part. 31% of participants lost their jobs. They faced higher rates of housing insecurity and evictions. 53% were late on rent, compared to 21% pre-pandemic.
The fact that we have essential workers without legal status is fairly common knowledge, and it is something that employers kind of count on at the low end of the labor market.
Concerns also extend to health.
Close to 30% of our respondents got COVID, many of them before a vaccine was available. So the impacts on their health were significant, and oftentimes employers pressured workers to return to work even though they were COVID positive.
The study also found a decline in self-rated health. Only 6% of respondents reported excellent health compared to 19% pre-pandemic. There are an estimated 100,000 undocumented workers in the GTA and as many as 1 million nationally. The researchers hope the study will start conversation at the municipal and federal government levels.
I think we need to take a serious look at regularizing all non-status workers, right? Not just a few of them, not based on English language ability, but if you're here and you're working, you should get permanent residence.
The study also found participants were highly responsive when it came to following public health measures, such as purchasing masks and hand sanitizer, even when money was low. Yet factors like living in overcrowded housing made it difficult to self-isolate. For City News, I'm Maleeha Sheikh.